Hello, I am Dr. Hannah Backstrom, Doctor of Acupuncture and Chinese Medicine. I'm practicing in Chicago. I specialize in labor prep and birth acupuncture and a bunch of other stuff. And you are?
I'm Hannah Sawitsky, and I am a licensed clinical counselor in Utah, and I specialize in maternal mental health. And I'm a doula, so all the baby preparation and especially postpartum prep is something I'm really passionate about.
And today we're going to talk about preparing for labor. We're going to talk about preparing your body for labor, preparing your mind for labor, and then like things you can do in an evidence-based way to help spontaneous labor along.
Perfect.
Yeah.
Do you want to start?
Sure. Um, so when I was preparing my body for labor the first time, um, with my firstborn, I tried to stay as active as possible, in a healthy way. Like I went to a lot of prenatal classes, I did a lot of walking, I tried to stay fit and limber and loose, and my body felt really pretty good throughout. As good as it can feel, because I'm not one of those people who love being pregnant. I do not like being pregnant at all. Like, no, no, I don't like it. Um, and my job keeps me on my feet a lot. So staying
Mm-hmm.
active, I think, was really helpful in prepping for the marathon that is labor,
Mm-hmm.
right? Um,
Yeah,
how,
imagining that physical activity is your training, is your conditioning for labor so that your
yeah,
body's ready for that.
yeah, the squatting down to pick that thing up from the ground, training. Putting your shoes on, training. It's real. It's
Yeah.
real. How did you prep physically for labor?
The first, well, with our first, a lot of my physical preparation was focused on getting her to turn over. So I really got very focused on physical preparation in the last kind of 4 to 6 weeks that I was pregnant because she was breech from 30 something weeks on, maybe 32. And so I started going to weekly massage with a massage therapist who specializes in pregnancy massage. Um, I did a spinning babies. I went to a spinning babies intro, and this my second baby. I did a full spinning babies class. So it was actually very helpful to get the full experience the second time, but I did get introduced to spinning babies with the first. I did acupuncture and we were doing moxa, which we talked about last video.
Mm-hmm.
Um, and it was kind of, I didn't have to do anything to get labor started because my water broke spontaneously at 38 weeks. So all the prep or the sort of get labor going stuff, I just got very surprised by labor beginning on its own, which was totally different than the second. So that
Yeah.
was the first. Second, I did chiropractic care. I did
Mm-hmm.
acupuncture again. I did spinning babies, but not just the class, like we did it every day. We did the daily balances every day, which I think was helpful because my second baby wasn't breech.
Yeah.
And I think part of that was stress reduction, but also that I did a lot of stuff throughout my pregnancy so that my body was in a place where he could be head down.
Mm-hmm.
And massage again the second time.
Nice. Oh, that's great. For me, it can be so hard to find a massage therapist when you're pregnant that will actually massage you.
Mm,
And I got so turned off by like a special, it's like oh, this person's really good at prenatal. And it felt like a cat was walking on my back. Like it had like the opposite effect. Like I walked out there tighter and more
oh.
frustrated than I was walking in.
Mm,
And I think because of that experience now, I'm like, it's so important to me that when a pregnant mom or when a pregnant person comes in and they are physically uncomfortable, that I give them an actual treatment.
Mm-hmm.
Like that I don't, I mean, their body is, everyone's body is delicate, but that I actually treat them like they are a human with a body with muscles that are in pain.
Mm-hmm.
Like if your low back hurts, we're going to do everything we can to help your low back to get you
Mm-hmm.
through the next 6 to 8 weeks.
Yeah.
Um,
Well, and being
I,
educated on how to provide that in a way that's safe. Like,
yeah,
I want to give your body the relief or support it needs. And I also know how to avoid risks.
hmm,
And having any provider, whether it's acupuncture or Chinese medicine or chiropractor or massage therapist, that are trained to know what is safe and where the boundaries are while
hmm,
still actually providing you some relief.
yeah, that's really important. Which is why you should not get needled by someone who's not an acupuncturist.
Mm-hmm.
Don't do it. Don't get dry needling done by a PT. Don't get needling by a chiropractor unless they finish their master's program in acupuncture.
Mm,
Because there is a lot of training that gets left out,
a lot of nuance.
a lot of nuance that gets left out.
Mm-hmm.
Um, yeah. I also, with my first, I got adjusted a lot.
Mm-hmm.
And then I did, oh, it fell out of my head. But there was a lot of squatting, a lot of squatting physically to get ready. Um, and like, I think that's in terms of like pre labor starting, that's kind of like the, other than like things to actively try and encourage labor,
Mm-hmm.
physically, that's all I can think of that I did right now. Like adjustments. I think I did get some acupuncture, just like treating my body really nicely.
Mm-hmm. Well, and those are this kind of is a good segue because those are the physical preparation things that you can do so your
Hmm,
body's in a place to do well in labor. And
hmm,
I think we also wanted to speak to the emotional preparation for labor. And we were talking the other day about one part of emotional preparation is knowing, preparing yourself for the experience of labor. And
yeah.
I don't know if you're willing to tell your anecdote about kind of whether it's better to have a really positive outlook, like this is going to go really well and be easy, or I'm prepared for this to be challenging mentally and emotionally.
Yeah. I mean, in the labors that I've seen, so I will usually see people, um, if like for just for labor prep, if
Yeah.
they're overdue, they'll come in for a labor prep acupuncture session. And
Mm-hmm.
those are 2 hours long because we spend the first hour talking.
Mm-hmm.
We spend the first hour discussing, where is your brain at? How is your first birth if
Mm-hmm.
this is your second? Like how are you feeling about labor? What is it that you're not telling the people that you love and need support from that like
Mm-hmm.
needs to come out? Because usually, not always, but usually there's some level of like something they're not talking about or comfortable talking about
Mm-hmm.
or afraid to share.
Yeah.
Um, and so it's uh, and it is a question of like, where is your brain at in terms of how you feel about going into labor? And
Mm-hmm.
in my opinion, when with me, the moms who are coming to see me are usually giving birth at the birth center, and so there's no option for epidural. If you want an epidural, you have to get into an ambulance mid labor
Wow.
and transfer to a hospital.
Mm-hmm.
And so it's a much bigger deal if you decide to like, if you change your mind, which you are 100%
Yeah.
entitled to do,
Or
you
yeah,
can change your
you
mind.
you want to access another resource or a different option.
Yeah. Or if you like,
Yeah.
you just decide like, oh, actually, this sucks. I would like an epidural.
Yeah.
And so like, and that's great, amazing, so good. We know that information now. Let's get you on your way, and you can have a lovely nap, and take a break, and
Have
do
your
all these
baby.
things. Have your baby.
Yeah.
Um, the mothers I have seen who assure me that they have a really high pain tolerance and tell me that it's going to be easy,
Hmm.
have, they have, not all of them, but most of them have transferred.
Hmm.
And it's so hard to not interpret that information as like, are things that we're thinking about with that information.
Hmm.
Are they going in mentally prepared to do the hardest thing that they have ever done in their whole entire life,
Yeah.
which is labor, and like
Hmm.
both times, for me at least.
Hmm.
Like, are you ready to do this thing that's scary? You've never done it before, right? Nobody knows what's going to happen, and
Yeah.
you have to walk in and mentally be prepared to do the hardest thing you've ever done.
Hmm. It strikes me that there's two elements because I do see the value in manifesting a positive experience for birth and like
Hmm.
if I'm preparing for labor that I'm like I want to find ease in my laboring. I want to find like I'm creating an image in my mind of having an experience that is comfortable. Like I did hypnobirthing and there's a lot of
Yeah,
language with hypnobirthing around like my body is relaxed, I am comfortable, I'm working with my baby, where the focus is definitely on the comfort of the experience and
hmm,
finding ease and flow and like peace in your body. And then there's the other side where you are doing a very physically demanding thing that can come with discomfort or pain, however you want to frame it.
yeah,
And to manifest like I wonder where both can exist where you can like
yeah,
my second labor I would characterize as very peaceful
hmm,
and but was it without discomfort or fear or pain at points? No.
yeah,
And so how can we prepare for both where we are creating relaxation in our body because tensing our muscles is going to interfere with our labor,
yeah.
being tense or having like not contraction in the pushing your baby out sense, but like
Contracting all your sphincters.
yeah,
All your
how
sphincters need to relax.
yeah, we need relaxation and we need ease and we also are it's a mental game to get labor is really mental and
Yeah,
how much we think we can tolerate or being dedicated like I know that I can get through this regardless of how hard it gets or I know it's going to be hard and I still trust myself to do it.
oh, that's lovely. Yeah, I know it's going to be hard, and I trust myself to do it.
Mhm.
That's both.
Yeah.
I think I think the problem is where there's this like fear of even looking into the discomfort and pain associated with labor.
Mhm.
And so instead it becomes this kind of like this, oh, I have great pain tolerance, I totally trust myself.
Yeah.
And I'm also not looking at this thing that's actually like scaring the crap out of me.
Oh yeah, there has to be yeah, that's like in the emotional prep there has to be room for the whole spectrum of like
Yeah,
fear to excitement, elation, joy. It's all going to exist and having space to express that like you said when you meet with your patients ahead of time to help them prepare for their labor that you're making space for what's not being spoken, what's not being felt, what's being avoided. That there's a difference
yeah,
between the denial of the discomfort or the pain Like if I'm just saying this is going to be easy and I'm denying that that's possible in my experience versus I'm manifesting ease, but I can face into discomfort and I can cope with discomfort.
Yeah, I'm confident in my body's ability
Yeah.
to do this
Yeah.
through discomfort.
Right.
It's tricky.
And it would be individualized. It would be like as a doula or a therapist working with someone prenatally, I would be helping them find their sense of that balance. And it's not about my ideas of how they should balance that, but helping them turn toward anything that they're avoiding, turn toward like those past birth experiences, turn toward feelings they're not wanting to address. How can we face in and make space? Because birth is kind of the epitome of creating space, creating an opening for this transition, and how people want to make that space is very personal.
Yeah. So in a case where someone had a not a negative, but a very challenging and difficult, maybe
Mm.
traumatic first labor,
Mm-hmm.
how would you, as master of the mind, help them help them turn into that experience?
Yeah. One thing I'll say is that I don't think everybody even can recognize when a previous experience is creating an emotional or physical block.
Mm-hmm.
So you might come into therapy with that insight and you might not. I usually start by asking about the story. Like, let's talk about your first birth. And in the story, I'm listening for where they are. It's like I'm really in my head about it. I'm telling the story about this, but I'm not connected to it in my body.
Mm-hmm.
And my process or my approach to that is to help them come like back into themselves and integrate the story with the feelings accompanying the story.
Mm-hmm.
That I might be able to tell the story of my son being taken to the NICU, but unless I can move that energy in my body and like land in how it actually felt to me for that to happen, I'm not going to be able to move through that energy or through that feeling and be on the other side of it.
Yeah. And what does moving energy look like? Like, what does moving that feeling look like?
Yeah. My approach as a mental health therapist and like very somatic based foundation is to gain start to pay attention to where sensations are showing up. So if you're my client, I'm going to be asking you as we spend a little bit of time in the story. We spend a little bit of time because it's going to stir it up in your body. But then I'm going to ask you to pay attention to what sensations are getting your attention. Like, oh, my chest is starting to feel really heavy or really tight, or I have this sort of like pinching sensation in my chest, or my belly is churning. A lot of times it's like chest and throat, like things we haven't said or expressed get stuck here.
Mm-hmm.
But we're going to land in your body, what's happening with you, and then we're going to let it get bigger.
No, can't
Yeah.
can't do that.
Right. Right. Which is yeah, of course. You're going to ask me to go further into this really deeply uncomfortable thing. And I know what I'm asking people to do. I totally
Yeah.
understand that it's a huge leap. It's a huge suggestion to say, let's pay attention to your stomach or your chest, and as you're breathing, making space for that sensation to get as big as it wants to be. Ideally, we would have time for this where if a if the person I'm working with says like that's as far as I can go today,
Mm-hmm.
then that's as far as we go that day. And we're just gradually getting more comfortable with letting it get big and tolerating it being
Yeah.
big.
Yeah.
And then there's a peak. It doesn't just get bigger in infinitely. There's a peak and then there's another side. And that's where I want to help people get to is like I got to ride the whole wave of this experience or this feeling and I survived it. I survived it in this session. I survived it in real life and I can cope with it being big. So the wave will come up again. I'm not, it will, but it's going to be smaller next time and I'm going to be better equipped. Oh, and then like maybe I just get really good at being scared. I get really good at feeling sad or mad. And, later, like 2 years down the road, I think about my birth and I feel integrated about it. I know the story, I know my body, but also I've moved it and it doesn't have the same grip on me as it
Mm-hmm.
did year one.
Yeah. Love.
How about from your approach? You want to talk about
In
the same kind of situation when you're seeing moms coming in for either their first or a subsequent birth and working through barriers that might be interfering with their labor starting?
Yeah. Yeah. So, in our labor prep appointments, I always ask about if it's their first, I always ask like, how are you feeling about going into labor? Like,
Mm,
what are your concerns? What are your fears? What's really going on? Um, and if it's the second labor, I always ask about
their
the first
first.
one. And usually we will find something that the mom is feeling scared or concerned about
Mm-hmm.
that, um, in my opinion, in my non evidence based opinion, full disclosure, um, that situation, that stress, that like holding of that fear and concern and not talking to other people about it
Mm,
is creating so much stress that it's stopping the oxytocin
mm,
from starting. It's like, because it's pretty gentle in the beginning, those hormones, right? They can start and stop because your body's just trying to make sure that you are safe. Like it is a survival mechanism.
mm-hmm.
Labor will not start if you do not feel safe.
Mm-hmm.
Because if you're being chased by a tiger, your body's like, no, you can't.
Now's not the
This
time.
is not an appropriate. This is not an appropriate time. We're gonna hold off, shut that down. Because once you get into that oxytocin hormone feedback loop, there's no
Mm,
stopping it. So that beginning part is really um, like nuanced. And so something as small as like not as, and it's not small because it's you and your body and what you went through,
mm-hmm.
but something as intangible as a fear,
Mm-hmm.
as an unexpressed feeling
Mm-hmm.
can keep you from like flipping that switch over and staying.
Yeah.
And so I'm still learning, but a lot of what I do is once we find whatever fear, or whatever issues coming up for the mom around labor, around birth, around after, because people feel like they
Mm-hmm.
aren't allowed to have feelings. Especially pregnant people feel like they're not allowed to rage or cry or sob or be sad
Mm-hmm.
because they have this idea that they're hurting the baby.
Mm-hmm.
And in that, in my non-evidence based opinion, just sharing my opinion, that's not the reality.
Mm-hmm.
That by not allowing yourself to express that full range of emotion,
Mm-hmm.
you are then creating more stress. That is not helpful.
Yeah. And actually, by moving it, you're doing yourself a favor and your baby a favor because you're not in a stress response. Because
Yeah.
I'm
Yeah.
fairly confident that there is evidence about the impact of stress on babies. So holding
There
stress
is.
in your body and high cortisol, and that's going to
Mhm.
have more of an impact than I'm going to let myself have a big feeling and move that big feeling and give my body the gift of that resolution.
Yeah. Releasing
Yeah.
that cortisol,
Yeah.
reconnecting with your body. And I also think like it's good for babies to experience the full range of emotion. We're just prepping them for life on the outside.
Mhm.
Like, look at how beautiful life is, baby. You're crying one day, and the next, you're laughing so hard that you pee a little bit, which you should not be doing. You should all get pelvic floor physical therapy. That's not common, but not normal. You don't need to pee your pants anymore. Go get pelvic floor PT. But like, to show your baby, like, yes,
Mhm.
life is hard and it's beautiful and like it's all of these other things, like,
Mhm.
because they're going to be on the other side soon and they're going to see. And so it's a gift for them as well
Yeah.
to have this taste of life and what it is. And I think moms have this idea of like, no stress, no stress. I'm not going to be stressed. But it's like on the wrong end of it. Like they're so focused on
Mhm.
not being stressed that they feel like they can't have these feelings. Like,
More
oh, to cry is
constricted.
stress.
Yeah.
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 We're like, how do you feel if you're sad or having this emotion you need to move and you have a big cry and you like, you're covered in snot and your face is all wet
Yeah.
and but how do you feel afterward?
Mhm.
Like usually there's this weight lifted off of you, this sense of elation that happens after you allow yourself to express this big feeling because like you're not holding it anymore. You're not using energy to hold it and you're not maintaining that level of stress to kind of keep things status quo, which is stressful. You are a human. We are not meant to be straight lining the whole way.
Yeah.
Like
Yeah.
that's not it.
There's got to be fluctuations in how we can be equipped to tolerate those fluctuations and like engage with them instead of sort of just survive them, because even watching your body when you're explaining it, it's like very tight and very
Yeah.
controlled, and that just generally even outside of motherhood is has a profound effect on how we experience life and our relationships and ourselves, and creating space like in our bodies, the physical body, and like moving. I mean, in my sessions we move a lot. I'm We're
Yeah.
standing up and moving around the room and curling up on the couch and laying on the floor, and like we can create that space physically, but we're also creating it emotionally. And then our bodies are like, oh, okay. And now I need to make space for this person to come into the world. And inviting that
Yeah.
experience and all that energy.
It's epic.
Hmm. Yeah.
So mentally prepping for labor, maybe find a therapist that you love and trust early on, like
Mm-hmm.
first trimester.
Mm-hmm.
Are you trying to get ready for labor and it's your first trimester? Find a therapist you love
Yeah.
and like work on yourself.
Mm-hmm. This it
Make a safe space for
And
yourself.
that's a skill you're going to have in parenthood too. So starting sooner than later on, how
Yeah.
do I connect myself? How do I know myself? How do I express that to other people? The people who are going to support me, my family and friends, to my partner, because that is not a parenting specific skill. That's a life skill. To, can I tell you what's going on inside of me?
Mhm.
Woo!
Is it safe? Is it going to be
Yes,
safe?
is it safe to do this? And the more, this is like a whole other video. The more we withhold, the more that builds up behind the dam.
Yeah.
And it's not sustainable to withhold, withhold, withhold.
Yeah.
I remember yelling very loudly toward the end of my second birth that I was scared, just like screaming it. And how, like, I think part of it, no, this was before we talked about it actually, but just being able to express it. And so everybody around me knew what was going on with me. And like to have the scared feeling and to have people surround me, like, okay, like we are here. You're scared. We're here. And that it got to be true. And then obviously got through the moment.
Mm-hmm.
But to be able to speak it and know what it is, to be able to speak it.
Yeah.
I also had on and off labor for a week. And it wasn't until I left my environment. I mean, I delivered in a hospital, but this could be a birth center or getting people out of your home if you're having a home birth. I pretty much just said I would have contractions all night. I'd get up with my toddler, they'd go away for the whole day, and the same thing would happen the next night. And so finally I said, we just need to be out of this space. Like as soon as the day starts, my body was like, well, we can't have a baby.
We got
Yeah,
stuff
we
to
got
do.
stuff to do.
Someone needs me.
Yeah, it's not safe to have a baby right now because we have obligations. So it was leaving that environment and being in a place where I was like, my only job right now is to have this baby. And then being
Mm-hmm.
surrounded by people that I knew and trusted and was like, okay, this is what we're here to do. And like landing in that moment for me was the thing I needed to be able to let go of the I'm busy, I can't. The tiger, being chased by the tiger every day.
The tiger. Sometimes the tiger is as big as a 2 or 3 year old.
That tiger wants breakfast. What else do you want to add? I think you talked about any other evidence-based things that you wanted to share about.
Yes. So I think this was in our other video, but um, the Birth Center of Chicago, birthcenterofchicago.com, on their website, they have a week by week guide essentially. It's free. You don't have to be a patient there to do it. I'm going to look it up now to make sure that you guys, um, that I sent you to the right place.
And we'll link
You
it.
go to birthcenterofchicago.com. Yeah, we'll link it. Go to birthcenterofchicago.com. And then under their client resources, they have a week by week educational packet. And they get a lot of their information from Evidence Based Birth, which is a great place to
Mm-hmm.
go if you want to
Yeah.
be better educated about options and the actual evidence behind things, because surprise, surprise, there's not a lot of, it's hard to do a study on a pregnant person.
Mm-hmm.
And they essentially have a ways to encourage spontaneous labor with links to the evidence and the research
Mm-hmm.
around it. And so the two big things that I really love for labor prep physically is like you come in for your labor prep appointment. We talk for an hour. We touch on those emotions and feelings that are coming up for you around labor and delivery. The wide variety are normal. You're allowed
Mm-hmm.
to be sad. You're allowed to be scared. You're allowed to be mad. You're allowed to like feel a sense of grief and loss
Mm-hmm.
that it's not just going to be you and your husband anymore or your partner.
Yeah.
Like all of the wide variety, they are all normal. You are not a bad mom already. You are not a bad parent. No,
Mm-hmm.
no. Like let's come into acceptance of all of the feelings around giving birth to another human
Yeah.
being. And then I encourage them, and sometimes we will make a plan together. So, say you had a really traumatic first birth and you're not really talking to your doula or your partner about
Mm,
it. Great. Tell me all about it. Let's talk about it. Tell me where you're feeling it in your body, because that in Chinese medicine is important, where that feeling is being stored in your body. And we will like specify your treatment to that.
mm-hmm.
Um, and then we come up with a plan in terms of like what do you need your support people to say to you when this feeling comes up?
Mm, yeah.
What if you could go back and say whatever you in that traumatic experience was experiencing, what would you say to you on that hospital bed
Mm,
getting stitched up? Like what did you need to hear?
mm-hmm.
And so coming up with some very specific words of affirmation or a
Mm-hmm.
very specific plan and making sure that you feel comfortable and that you're ready to express feelings as they come up for
Yeah.
you. Like before I put needles in anybody, that is, let's, okay, great, let's figure out what's going on, let's make a plan, and then this is how you can execute the
Mm-hmm.
plan.
And then the
um,
acupuncture or the herbal medicine that you're using is aligned with that person and what they're needing
yes,
and where there is stress or tension in the body or energetic blocks.
yeah, yeah. So if it's anxiety, we're going to treat the heart and do some very
Mm,
specific points on the heart channel. If it's fear, we're going to treat the kidney and do some very specific points on the kidney channel.
yeah.
And sometimes it will be specific enough where like they tell me that they feel this tightness right here on their chest. And it's not really a game, but like I'll push on it.
Mm,
And if the pressure feels good, sometimes we put a needle in the spot where the pressure feels
mm-hmm.
good. If I push on it and the pressure feels uncomfortable, I will push on acupuncture points until we find the point that decreases that discomfort when I push
Mm.
on their chest. And so it can be really specific and specified to what that human being is experiencing in
And
the
you're getting
moment.
feedback. It's collaborative.
Yes, yes. And it is so important that whatever you do to prep for labor with whatever practitioner, that you feel comfortable and safe and in charge of
Yeah.
your body.
Yes. Consent, consent,
If you
consent.
feel like, yes, yes, and if things are happening to you in your body, even if you're doing things for labor prep that you're not comfortable with, it is not going to work for
Mm-hmm.
you. If you do not feel safe, if you do
Right.
not feel in control and in power of your body, whatever you're trying to do will not work.
Yeah. I want to add too,
I'm sorry.
you can do all the right things, and if you feel out of control or in a fight or flight response, all of those right things won't have the effect you're looking for.
No.
I'm also thinking about how like our two approaches, we've we've spoken to those, and like I did cranial sacral therapy to process my second birth, which is there's
I
some, the
love it.
practitioner I saw, there's some verbal pieces to it, but it's so different from talk therapy. And I know a hypnotherapist that also isn't doing the same thing that I'm doing. And so people finding the approach that works well for them, like finding support people that
Mm,
are going to help them approach their challenges in a way that works for them, is aligned with them. Like maybe I don't want to come in and tell my whole trauma story. So doing something that is different than talk therapy where I have to verbalize the whole thing can be more gentle and can also be another way to be supported. Like, oh, my the
mm,
energy in my body is telling this story, and cranial sacral is addressing that energy without me having to go into it cognitively. And
got it.
so there's just such a variety. Like I obviously really believe in the approach that I use and recognize that it's not the fit for everybody. But
Hmm.
finding what is a fit for you and getting supported in a way that works for you is important, not to go without support.
That's good to like be reminded of, that there are other options besides just talking about
Mm-hmm.
it.
Yeah.
Go to a dance
Yeah.
class, go see your
Or that
craniosacral.
the talking can, you don't have to start at 100 miles an hour. Like easing into, that's why giving yourself more time is so valuable, because
Hmm.
you're just gifting yourself the time to ease into it. Or like, I maybe my first therapy session I'm telling like this much of my whole story, but by the end of
Hmm.
6 months of meeting regularly, we have gotten through the whole thing. So you're
Yeah.
only doing yourself a favor by accessing Chinese medicine or accessing therapy or working with a doula or whatever you pick earlier, so that you have that time.
Moms who come in for things not related to labor
Mm-hmm.
prep. Like they come in at 35 weeks, 36 weeks. They come in at 30, like it, 20 weeks does not. None of them have gone past their due
Mm-hmm.
date. And I think there's something to be said about that body connection.
Yeah.
There's this like, I'm noticing this is really painful, or I'm having this experience right here, something's going on here, and they're coming in and getting care for that
Mm-hmm.
earlier on. They are a little bit more set up for those things to kind of just flow
Yeah.
in,
It's be
because they're responding to what their body is
Yeah.
asking them.
That labor prep isn't like, let's just get these contractions started. It's
Yeah.
a whole self getting ready to have a baby, and you're coming in with all of your
Mm-hmm.
stuff, and you're not going to stop being a whole self after your baby is born. So honoring that whole self and all your needs, and the your physical well-being and your emotional well-being as a whole, and not just to get your baby out.
Mm-hmm. Well, and that, like, for me personally, on a personal level, it is challenging because oftentimes I will see my labor prep patients after they are
Mm-hmm.
past their due date.
That's the
And so,
that's the oh shit, we got to do something now visit.
yeah, and like, I finally gotta say, like, 75% of my labor prep is like, because the people who see me before don't really need
Mm-hmm.
it. Like, none of them go overdue.
That's
They don't, like,
valuable. That's valuable to
yeah,
know.
yeah,
Yeah.
yeah. Like, get care for yourself now, because you're a lot less likely to have that oh
Yeah.
shit experience
You don't
later
have to
on.
scramble at the end.
Um, yes, and so it is like there is some scrambling that we're doing to try and help you get in the right
Mm-hmm.
mindset.
Help your body catch up, help you catch up emotionally.
Yeah. And I think in that instance, there, like, at least for me, there is some talking that is
Yeah.
required if you decide to come
Yeah.
see me. Like, there is this, like, if you're overdue and you're coming in to see me and you're not, like there's zero signs, I'm going to push
Mm-hmm.
you a little bit in a space where you feel safe, but I'm gonna try and talk to you about things that you probably don't want to talk to anybody
Mm-hmm.
about. Um, so I full disclosure, if you're overdue, it is important to consider and important to be open to doing those uncomfortable things and having those uncomfortable
Yeah.
discussions,
Yeah, definitely.
because it's really nice on the other side.
It is. It is.
Yeah. Um, so, and then talking about more evidence-based things, acupuncture is as effective at dilating the cervix as I can never remember the name. There's this tablet that
Cervidil
you put in the vagina next to this.
or Cytotec?
One of them.
Oh, yeah.
Misoprostol?
I
I
don't,
can't say
I
it right. I can go
wonder.
look it up.
Yeah, I know what you're talking about. There's several options.
But there are several options, and so acupuncture is as effective at
Oh,
dilating the
that's that.
cervix
That's the,
as.
yeah, it's the same as Cytotec. They're identical.
Okay,
It's the common name versus the brand name.
got it.
So
Got it.
acupuncture is as
Um,
effective.
in a few systematic reviews, they were like, look at this, they are the same trajectory with the same number of adverse effects because you want
Mm,
like we want to make sure we are not messing anybody up, that we're not making your labor last longer, that we're not causing any distress to anyone as an
yeah.
acupuncturist. And it was the same, they were the same, as effective, and they were
So
the same.
cool. You want to do a closer? You're so
Good
good at
team.
it.
Thank you for coming. Oh, the clip, got it. Yes. Labor prep starts in the first
Mm,
trimester, helping you get your mind right, remembering you are a whole person, not just someone giving
hmm.
birth. You are a whole person. So, treating yourself with working on some of those emotions as a human
Mm-hmm.
being will help you later on in labor and will help you as a parent because that shit is hard. And then staying
Mm-hmm.
limber, making sure that you are moving and exercising in ways that feel good to you. Get some pelvic floor physical
Yeah.
therapy if you are pregnant and uncomfortable. You do not have to sit and
Mm-hmm.
suffer. Get some chiropractic, get some acupuncture, do whatever helps you feel safe and whole and good in your body. Um, and then go get some acupuncture, eat some dates. We can talk more about
Yeah.
like helping prep spontaneous labor, but I think today the number one thing we talked about a lot was like making sure that you are in a space where you feel
Yeah.
safe, and having unexpressed emotions or having emotions you're not sharing with others or fears you're not sharing with others hinders you from
Yeah.
feeling safe.
Emotional prep and physical prep from the beginning.
Yeah. From the beginning. From the beginning.
Yeah.
Start now.
Okay. Thanks, Hannah. I really appreciate you.
Thank you.
I
This was
love chatting
lovely.
about this stuff. So, and all of our
I look
followers,
forward.
if you want us to cover a specific topic, just let us know. Send us a message, comment. Just
Give us some time to do
let
some
us know what you
research
want to
and I'll
talk
have my
about next.
facts then.